There are so many patients that are sick of glasses and contact lenses, but for one reason or another, maybe they're not a candidate for LASIK, maybe they just don't want LASIK. We've got Dr. Ashley Brissette, one of the greatest vision correction surgeons in America, and she's going to tell us some options for patients who either may not want LASIK or may not be a candidate for it. Dr. Brissette, what are some good options for patients who either don't want LASIK or aren't good candidates for it?
Well, one of my favorite surgeries to perform is actually something called the EVO ICL, or the implantable Collamer lens. This is a completely safe material that goes inside the eye, almost like a custom contact lens. It's truly customized for your eye shape, your prescription, your astigmatism. I make a small incision and I slide it to the inside of the eye. Surgery takes about 30 minutes to do. Usually by the next day, people are seeing better and feeling better. And what's so nice about this surgery is it's not a laser. It's not a LASIK reshaping to fix the vision. It's a completely customized lens on the inside of the eye. So there's no risk of dry eye disease after this surgery. It also has UV protection built into the lens, which is great for our eyes as we're growing older. And the other thing is it's completely reversible at any stage. So say if in 20 years a new technology came out and you preferred that instead, you could have this lens removed by a surgeon and then a new technology placed. So it gives you that optionality. Yeah.
That's incredible. So a lot of patients are good candidates for both of these procedures. And you've mentioned some things. EVO ICL is reversible. That's incredible.
Yeah.
So if you're in some small percentage of patients that just didn't like your vision or didn't want the lens anymore, you could just take it out.
Yeah.
The incision, that's a scary word. How big of a cut has to be made?
It's only about 3 millimeters, so it's very small. There's no stitches in the eye afterwards. And as I mentioned, the recovery is really quick and straightforward. Usually by the next day, people are seeing better and feeling better.
That's incredible.
And the satisfaction rates are over 99%. I believe in their studies, it was 99.4% of patients were thrilled with their vision after surgery.
And who is a good candidate for the EVO ICL that maybe is not a good candidate for LASIK?
Well, especially if you're a strong prescription, this is truly the preferred surgery. So this surgery can go anywhere from -3 all the way up to -20. So it gives a really wide range of treatment. So if you're a strong prescription and even we're told you're not a candidate for a vision correction surgery with a laser, you could be a candidate for EVO ICL.
That's incredible. I actually did a patient, the highest prescription I've ever seen was -30.
Yeah.
So they were -30 in glasses. There's a change in prescription when you go from glasses to contacts, so they were a -25 in contacts. And this patient actually got both procedures. They got the maximum strength EVO ICL, the -16, and then we did LASIK for the remaining 8 or 9 diopters, and they ended up 20/20 with both procedures.
It's amazing what we can do nowadays. I mean, it's very rare in medicine that we get to say something is life-changing, but I truly feel like the EVO ICL is one of those life-changing surgeries for people.
That's great. So if you've been told you're not a LASIK candidate, EVO ICL might be something that's a great option to get rid of those glasses and contacts. Thank you.
Thank you.
Excellent. To learn more about modern LASIK and other vision correction procedures such as EVO ICL, custom lens replacement, and more from some of the top vision correction specialists in America, and to find a surgeon near you, like and subscribe to our channel and visit bestlasicsurgeons.com.